So your doctor orders a diagnostic imaging test or a minor outpatient surgery, and you are wondering, will Medicare cover my procedure? Let's talk about how Medicare decides if a procedure is covered, and I'll give you my best tips on how you can avoid a surprise bill for a claim that Medicare has denied. You can also grab our Medicare coverage cheat sheet at the end of this video that will help you determine whether your next healthcare services are covered. When it comes to Medicare coverage of any procedure, the most important determining factor is medical necessity, which Medicare defines as healthcare services or supplies needed to diagnose or treat an illness, injury, condition, disease, or its symptoms, and that meet accepted standards of medicine. Based on this definition alone, you may be able to answer your own question right off the bat. For instance, if you're asking, will Medicare cover a cosmetic procedure such as cool sculpting, the answer is no. However, there are a few circumstances where your doctor can request a procedure to be covered, even if it isn't usually considered to be medically necessary. For example, Botox injections normally aren't covered because they aren't medically necessary when they are treating frown lines. However, some doctors now also prescribe Botox injections to treat things like migraines. Your doctor could submit documentation stating that the injections are medically necessary to treat a specific condition. If your procedure qualifies as medically necessary, then Medicare will nearly always cover it. While medical necessity is most important, there are other factors that may be relevant as well. One of these is that you need to get your healthcare services from a provider that accepts Medicare. Medicare has both participating and non-participating providers, and it also has doctors who have opted out altogether. Any care performed by a provider who has opted out of Medicare will not be covered at all, so you'll want to stick with participating and non-participating providers. A participating provider is a provider that accepts Medicare's assigned rates. In this case, Medicare will cover the cost of the covered procedure, and you shouldn't owe any excess charges or balance bills. If you receive treatment from a non-participating Medicare provider, that provider still accepts Medicare but doesn't agree to Medicare's low assignment rates. Non-participating providers can charge an excess charge of up to 15% more than what Medicare covers in most states. You could end up with a balance bill that you will need to pay. Fortunately, some Medigap plans do cover excess charges for you. For example, a Medicare Supplement Plan G will pay the excess charges, so you won't have to ask whether your doctor accepts Medicare assignment. On the other hand, if you enroll in a Medigap Plan N, which doesn't cover it, you could owe some excess charges when you treat with non-participating providers that do not accept Medicare's assigned rates. Although Plan N is often cheaper than Plan G, here at Boomer Benefits, we do find that clients who enroll in Plan N will sometimes contact us later and prefer to move to Plan G because they find those little balance bills for excess charges annoying. I should also mention that there are a few states where excess charges just simply are not allowed. We have a blog post about this that I'll link to in the notes below this video so that you can check it to see if your state allows excess charges. It's uncommon for people on Medicare to receive bills in the mail from their providers. Most beneficiaries aren't sure whether they actually owe these bills or not. It can be especially stressful to receive a bunch of bills in the mail after a hospital stay. This can happen for a number of different reasons. One is that your provider bills you for the service before Medicare has had a chance to pay. This one is so common that here at Boomer Benefits, we tell our Medicare clients to contact our client service team first before paying any bill they receive in the mail. Our team researches these for our clients to make sure that they don't accidentally pay a bill that in fact is already covered by Medicare or their Medigap plan. Another cause of unexpected bills is your doctor miscoding the procedure when billing Medicare. Unfortunately, this one happens often as well. Every service, procedure, prescription, and doctor visit has a medical code that corresponds with it. This code is how the doctor's office, the billing department, and the insurance company communicate with each other. The code indicates what happened during the visit or healthcare service. A medical bill may even have multiple codes detailing how the services and procedures should be charged. If the wrong code is chosen for the type of visit, Medicare could deny the bill when in fact it should have been covered. Medicare would then return it to the doctor's office and the doctor would bill you to pay in full, leaving you wondering, what just happened? We research and resolve bills like these for our policyholders every day. In 2022, we collectively saved our clients nearly $1 million by getting bills properly recoded and asking providers to resubmit them with correct codes so that our clients' Medicare and Medigap or Medicare Advantage plan would pay. The Welcome to Medicare visit is another example. This is a doctor visit that you can schedule within your first 12 months of being on Medicare. If coded correctly, this visit is 100% covered by Medicare Part B. However, if the medical coder doesn't use the right code for this visit, Medicare may not cover it correctly since the translation of the service provided was incorrect. Our client service team resolves complex billing hassles like these for our policyholders at no charge. Our service is free, so why shop for your policies anywhere else? There are also certain things that Medicare has limits on. For example, Medicare Part A only covers up to 150 consecutive days in the hospital. After that, the cost of your inpatient stay comes out of your own pocket, unless you have coverage like a Medigap policy to provide you an additional 365 days. Or if you go into a skilled nursing facility after a hospital stay, Medicare only covers up to 100 days. After that, you are on your own because Medicare doesn't cover long-term care. Likewise, with physical therapy, Medicare covers up to a certain amount each year, and after that point, they could request a review with your provider to verify that that continued therapy is really necessary. These ordinary limits could result in unexpected bills if you didn't know about them, so it's always a good idea to familiarize yourself with what original Medicare covers, and the other videos in our What Medicare Covers playlist will help you get a good handle on that. Now let's talk about things that you can do to help yourself avoid unexpected bills. First, don't be afraid to ask your provider upfront if Medicare covers the procedure that you are about to undergo. Second, you can also use Medicare's What's Covered app to see if Medicare covers your procedure in general. Third, if you don't have a Medigap plan that covers excess charges for you, be sure to ask every healthcare provider or facility upfront whether they accept Medicare assignment rates. This will help you avoid the excess charges that we talked about earlier. Finally, you will want to research any bill that comes in that you thought Medicare should have covered for you. Never pay an unexpected bill without checking to be sure that you truly owe that bill. And again, if you bought your policy through Boomer Benefits, just make a quick call to our service team or submit a request in our client portal and we will handle it for you there at no charge. If you bought your policy directly from a big insurance carrier, you are unfortunately on your own. You'll need to contact your provider's billing department to see if they coded the procedure correctly when they originally billed Medicare. If they didn't, they'll need to resubmit the bill with the correct coding. I should also mention that when you have an unpaid bill, you don't have to wait for Medicare's quarterly summary notice to arrive in your mailbox to try to figure out what happened. You can sign up for mymedicare.gov, and this will allow you to see your claims as soon as they are processed. To grab our ultra handy Medicare coverage cheat sheet, visit the link that I left for you in the description below this video and check out our video on Medicare Parts Explained for more Medicare basics.